and welcome back to the Healthbeat Show. I'm Dr. Jeffrey Watson, and joining me today is none other than podiatrist from Happy Feet Podiatry, Dr. Janelle Green. Welcome to the Healthbeat Show.
Thank you for having me, Dr. Watson.
I'm so happy to have you here, particularly at this time in the healthcare system, because you have told me that your goal
is to rejuvenate the soul.
And that's what it's all about.
Absolutely.
From the foot up. A lot of times you
Absolutely.
hear me talk about from your nose down to your toes. And so now tell me a little bit about yourself. Where are you from?
So I'm originally from San Francisco, California.
Okay.
Yeah, born and raised, and went away to, my education is in the South and on the East Coast.
Oh, okay.
Yeah, so I went to the Tuskegee University.
Oh, fantastic.
Yeah, and studied at Auburn University. I did grad school there, and I actually came back to Northern California, right over here at Summit, to go to Samuel Merritt for podiatry school.
Okay.
Yeah, and then following that, I've had a lot of education. I did training on the East Coast. So I worked at the VA in New Jersey.
Now, was that like a residency?
Absolutely, yeah. I was there for 3 years and did a 3-year residency there in the East Coast. Yeah.
How long is podiatry school?
Podiatry school is 4 years. So the actual education, the school is 4 years.
So it's almost like medical school. I mean, it is, you're a doctor of podiatric medicine. Is that what you would call it?
That's correct. Yeah. So the education portion is 4 years, and we actually start going out into the field as second-year students. So we get a chance to get a feel for the feet as second-year students because we know what our specialty is going to be. And then after graduation, we do more commonly, they're 3-year residencies now, and some even do fellowships afterwards. So after I finished at the VA in New Jersey, I actually went to USC and did a research fellowship in diabetes self-care.
Oh, wow, that's fantastic. So now, what is a podiatrist actually? You have people that get it mixed up with psychiatrist or other
Pediatrician.
names. Pediatrician,
Yeah.
What is a podiatrist?
So a podiatrist is a physician that can diagnose and prescribe and treat any ailment in the lower extremity, the foot and ankle. And any part of the foot, the skin of the feet, the nails, the bones, the soft tissue, that's our focus, and that's our specialty.
And the foot is so important. You talked about Happy Feet, and your goal is to
rejuvenate you from the soul, the soul up.
Yeah, from
Absolutely.
the soul up. Because if your feet hurt, you can't even stand up. You know, you can't function right.
Absolutely, and so many people take their feet for granted, as especially our young people. We don't come into the doctor unless there is a problem, and as we age, then we start to feel those aches a little bit more all over our bodies, especially our feet, but our feet are very important.
And you know, that's something very important that you're talking about. A lot of people don't want to go to the foot doctor. They don't want to go to the regular doctor. And we are noticing that as in many areas of disparities, meaning difference between white, black, Asians, Latinos, if you go into a dialysis center, you will find that many of the people who have their toes or feet amputated are African American. You know, why do you think that is?
Well, I think that's the case a lot of times because, for one, a lot of African Americans, a lot of us, we don't really know how to care to our feet. We don't know when we should go to the doctor. And then unfortunately, because of the long history, the unfortunate history that we've had within the healthcare system of being abused in the past, a lot of us still have hesitancy. We coined that term hesitancy with the vaccination, with recent vaccinations. But we've been hesitant to go to the doctor for a long time. And so a lot of times we just don't want to go. We're afraid to go because we don't want to get bad news.
Now, a lot of people aren't afraid to go get their nails done at a salon. And I've had people come in to me and they've had a bad situation that happened with their nails at a salon. Is that the only place that a person should go to look at their foot health, is the salon?
Absolutely not. So your foot health starts at home. So when you, just like you get into the habit of brushing your teeth, you should get into the habit of looking at your feet, checking in between your toes. So the foot health starts with all health at home, in the mirror with yourself. Yeah.
Okay, and you talk about everything from the nails to the sole of the foot to the heel of the foot. How far up does a foot doctor go? Does it go past the knee up to the hip, or just up to the knee, or halfway up the shin? How far would one go? I mean, there's an orthopedic, which is a bone doctor, but there's the podiatrist, which really deals more with the foot. How far up does the foot doctor go?
So as a podiatrist, how far up I go, or what's my scope of practice?
Yes.
Is if it's soft tissue, we go up to the knee. So anything from the toe to the knee, we can treat. If it's a vessel, or if you have a wound, a lot of times people have wounds around their ankle or their upper leg. A podiatrist can treat those. We also do, if you have swelling in the upper part of your leg, we can help with compression and providing you with this whatever you need to get the swelling down. If it has to do with the bone, then it's the lower part of the leg. It's the foot and the ankle only. So if it's bone, foot and ankle only, if it's soft tissue, we can go up to the knee.
And so a lot of people are trying to figure out what's the best shoe to wear that's healthy for your foot. Do you have any thoughts about that? I mean, I'm on my feet all day long. My feet hurt. And I see a lot of healthcare people wearing clogs. And I don't know that I could keep a clog on my foot all day. What's the best kind of shoe to wear if you stand a lot?
So if you're standing a lot in one place, you absolutely need to have a shoe that is supportive. And that's why people wear clogs, because the bottom is wooden. It is very supportive. Those aren't the only types of shoes that are supportive. But the first thing is, whenever our people get new shoes, I always tell them measure their feet, because that's a common misconception, is that your foot stays the same length and width over your entire life. And that changes as our body weight changes, as we walk, as our soft tissues stretch out and get relaxed, our foot kind of gets flat. So the first thing you want to do is make sure you measure your foot when you go to get new shoes. And then you also want to make sure that the shoe is wide enough for your foot. Sometimes people get a shoe and it's so narrow and it's pushing up in the parts of the bottom of their foot, and it's the wrong place. You want to get a shoe that has I should have brought a shoe in here with me, but that doesn't, it doesn't have a lot of torque. So some shoes, you can take them and you can squish them up like a little ball and roll them over. Other shoes, you cannot. You can't. You want to get a shoe that doesn't allow you to twist it and turn it and smash it up like a ball.
It's got to be stable.
It has to be stable, right? Because if you can do that with that shoe, then it's not providing you with the support. And that support is very important if you're on your feet, if you're walking, if you do hair, or if you're a physician, barber, if you're in construction work. That's why construction workers, they have not only the steel toe boots, but the bottom of the shoe is very stiff and sturdy.
Okay, we're right here with Dr. Janelle Green from Happy Feet Podiatry. And your slogan is?
I rejuvenate you from the soul up.
All right. I'm Dr. Jeffrey Watson, right here on the Healthbeat Show. Stay tuned. We're going to be talking about your toes. We're going to talk about toenails, your heels, what high heels, turf toe, fungus, all that kind of stuff. Stay tuned. We'll be right back.
So they say it's a man's world? I don't see anybody's name on it.
While they were doing their thing, we slowly changed ours.
Today, women can do anything men can do. And there's one thing we're even better at.
For advertising and sponsorship opportunities, log on to healthbeattv.info.
I'm Dr. Jeffrey Watson. For more information, go to our website, healthbeattv.info. You'll hear more about the information that we're giving you on the Healthbeat Show.
The Healthbeat Show, sponsored by Watson Wellness Water. Your health is your wealth.
Well, Thomas, you've got prediabetes. But with more exercise and a change in diet, it can be reversed.
I've tried exercising. It just makes me hungry. for bacon.
I love bacon too. And who really likes to exercise?
Not me.
Me neither.
Nobody. So we're good?
What? Oh, you still have prediabetes. Big time.
I'm Dr. Jeffrey Watson. We are right back here on the Healthbeat Show. I am with Dr. Janelle Green, podiatrist from Happy Feet Podiatry. Now, you know, there was a point in time when my heel started really hurting. And I thought that I had stepped on some glass. I mean, I was limping. People were telling me that I was limping, and it was like, it was like right back here in my heel. Now, I went to a foot doctor, we talked about reluctancy, but I went to a foot doctor. They took an x-ray of my foot, and I saw a little piece of bone that looked like a pin sticking in my heel. What is that?
So it's what you're describing is plantar fasciitis,
Okay.
right? And so plantar fasciitis, many of the symptoms are when you have been resting, sitting down, or lying down after sleeping, and you step down that first step in the morning. It is like something is stabbing you.
Oh, it hurts so bad.
Yeah, in the bottom of the foot. And as you kind of walk on it, it can get a little bit better. But what's happening is it really starts in the back at your Achilles tendon. So a lot of people are familiar with that thick, soft tissue in the back on the heel. It's called your Achilles tendon, and that it connects, right? And so that tendon connects to the heel bone, and then it kind of spreads out into three little bands. We call them 3 bands at the bottom. Okay, and if your foot is really tight, what happens is we're in the bed or when we're resting, our foot is kind of relaxed, so we don't feel pain. But as soon as we step down and that foot straightens out, that fascia pulls on this heel bone, and it pulls so much that it can even stretch out that heel bone. So you probably saw on your x-ray, it looked like your bone was growing.
Yeah, it looked like a little needle in there.
A little needle, or the bone is growing. And that's because not only is the soft tissues down here tight, but your Achilles tendon in the back of your leg is tight as well.
You know, and that leads me to another question. What about if you get foot cramps? Like when I get in the bed at night sometimes, I get cramps in my feet. And what is that about?
Well, that could be from a number of reasons. It could be a vitamin deficiency. It could be dehydration.
Not enough water, huh?
Not enough. People underestimate the amount of water that they need. Yeah, it could be dehydration. Yeah.
Wow, yeah. And I have to move around to try to get that cramping from going away. Now, the other thing, you know, we were talking about going to the salon. Now, a lot of ladies go to the salon. Men don't go so much. But they get these big fat nails that have fungus in them. And first time I saw it, I didn't know what it was. Sometimes the nail is black, or sometimes it's just thick and flaky. I mean, what is the cause of that? Why does that happen?
So what you got to understand, so fungus likes dark, moist areas. Fungus lives all around our environment, and it's just waiting to attach on to our bodies so that it can grow, so that it can thrive. So when you have any trauma to the nail, if somebody steps on your toe real hard, or if you bump your toe, then that can allow the fungus that's out there lurking to come in. So if you have any type of micro trauma, it could be the shoe that's causing a lot of pressure on your toenail. And that trauma opens the door for fungus to come in. So when you go to a nail salon and you have that door open for fungus to come in, and somebody is polishing your toenails with a nail polish that maybe somebody else had fungus on, and they use it on your toenail.
They're giving you fungus.
They're giving you fungus, but you're also welcoming it in too, because you have this trauma that's been present. And it may not be a big open wound, it's just little tiny fine little cracks.
Now I know, you know, people get this thing, athlete's foot, where they get fungus in between the toes. But a nail is hard, and you can get some cream to put between the toes, like nystatin cream or some kind of fungus cream. But how do you get that fungus out of the nail? What do you do?
So there's different things. I like to treat patients topically and orally because a lot of times when we have fungus on our toenails, it also lives in the body. So there's, you can use the nystatin cream that you talked about putting in between the toes. That can also be put on the nails.
Will it go down into the nail if you put it on top?
So one of the things that I encourage my patients to do is to use a nail file when applying it and just do a couple strokes across the top, which would help the medication penetrate a little bit better. But in addition to that, if the nail is super thick, like you described, it's like a big boulder or a rock, they need to come in and see a podiatrist and have it filed down to an appropriate length so that the medication can penetrate, because the fungus is living in the nail bed and it's growing up, and that's why you see the discoloration. It may be black, sometimes it's green or yellow, and so you have to get in the habit of treating that topically, and then also you can take pills and treat it that way as well.
You know, my daughter is a dancer. I'm very, very proud of her, but she dances on her toes, and she has had problems with her toes, her heels, and that tendon that you call the Achilles tendon. And then there are athletes. I played football, I ran track. I had problems with my feet, and you hear about football players who stub their toe when they're running, and they call it turf toe. What is that? What is turf toe?
What is turf toe? So what you have to remember is that so looking at this model, you see the bones, but even the bones in this model are connected by these little, I don't know if you can see that, soft tissue. So if you just imagine that every bone needs to be connected by a stretchy rubber band or soft tissue. And so what happens is if you pull that rubber band too tight, or if that rubber band gets too stiff, it's going to sprain itself, or strain, tear, or even break. And so what happens is when people are kind of doing this a lot, and that happens with dancers, it happens with athletes, if they're doing a quick running maneuver, that rubber band or those tissues down here get strained, and they pull and they can pop. And so that's what turf toe is when in that big toe joint, those soft tissues around there have gotten strained too much to the point where they're just exhausted and tired and painful, or they just tear.
Wow.
Yeah.
Turf toe. I've had some problems with my feet. We are here with Dr. Janelle Green, and she has Happy Feet Podiatry. And where are you located right now?
I am located at 5709 Market Street here in Oakland, California.
At the James A. Watson Wellness Center. And we're very happy to have her here. And when we come back, we're going to talk about high heels.
All right.
I love to see ladies in high heels.
Okay.
All right, so stay tuned. We're coming right back. I'm Dr. Watson with Dr. Janelle Green, podiatrist.
The Healthbeat Show, sponsored by Watson Wellness Water. Your health is your wealth.
You've been diagnosed with type 2 diabetes. You have to carefully monitor your health for the rest of your life, and you have an increased risk of developing cardiovascular disease.
Cut.
Type 2, take 2.
Action.
You've been diagnosed with a new purpose: to fight for the amazing life you made for yourself, to look that risk of heart disease square in the face and say, no, not me. You've been given a new opportunity to live. Get started at NoDiabetesByHeart.org.
For advertising and sponsorship opportunities, log on to healthbeattv.info.
I'm Dr. Jeffrey Watson. For more information, go to our website, healthbeattv.info. You'll hear more about the information that we're giving you on the Healthbeat Show.
Hart, what's going on? I'm leaving. Why? What did I do? Not enough. You constantly ignore me. You barely eat anything healthy. You're half as active as you used to be. The pressure is just too much. I quit. Okay, I get it. I'll do better. Just, please, don't leave. Okay. But remember, if I go, you go.
Listen to your heart. Don't let it quit on you. Uncontrolled high blood pressure could lead to stroke, heart attack, or death. Get yours to a healthy range before it's too late.
I'm Dr. Jeffrey Watson. Welcome back to the Healthbeat Show. We're having a great talk because you always hear us talking about from your nose to your toes. And today we have Dr. Janelle Green, podiatrist from Happy Feet Podiatry. Now, we talked a little bit about nail fungus. We talked a little bit about heel spurs, or what you call plantar fasciitis. And we talked about some of the different kinds of shoes. I love to see a lady in high heel shoes. It does something sexy to their legs. You know, what is that? How is it that just be in the heel shoe, it changes the whole posture, it seems like?
Well, that's exactly what you said. And I will say this, ladies, many ladies love to wear high heel shoes too. But that's exactly right. It changes the posture, the form, the body is more straight, erect. It provides the woman with more, more of a build, right? So women love to wear high heel shoes, but the feet don't always like them.
Yeah, and a lot of high heel shoes have pointy toes.
Absolutely.
And so what happens when you've got the toes going down into that point?
Right. And so when you think about standing up, if you've ever thought about how you have to balance yourself, you know, if you're off balance, then you may fall. And so when you wear high heel shoes, all of the balance or your body goes to the front. So if you see a woman walking with high heel shoes, you might just push her over and she'll fall. But in thinking about that, all the pressure from the body is now on the balls of the feet and on the toes. That's a lot of weight. And then they're jammed into these pointy shoes, okay? And that's why the toes, in order to accommodate that and get adjusted, they have to curl up to fit into that shoe box.
Yeah.
And then the bottom part of the ball of the foot it has to be, hopefully it's nice and fat, the ball of the foot, to bear that weight, to absorb the shock of all that pressure from the body. But as we get older, and if we're wearing high heel shoes a lot, that fat part of our foot wears down. And so that can be very, very painful. In addition to that, like we talked about that Achilles tendon in the back of that leg, if you're hiking it, the heel up all the time, then that tendon gets shorter too. Yeah.
And then you get bunions.
Oh, yes.
The toes start to cross over and you get bunions and so on. Now, something that is just so common that we haven't touched on yet, and that's diabetic feet. Diabetic feet. Why does diabetes cause feet to get numb, or to get sores on them, or to lose toes, or to get injured and infected? What is it about diabetes that causes those kinds of problems in feet?
Okay, so I could go into a rabbit hole. I love talking about this. But the numbness comes from so we know diabetes, people call it sugar. We have too much sugar in the blood. And sugar is a preservative. It dries things out. So, I think my grandmother used to can things, and you put sugar dries things out. So what's happening is when you have a lot of sugar in your blood, it's drying out your nerves. And when it's drying out the nerves, your nerves are screaming. And they are getting on your nerves. So you have burning, tingling, pins and needles, all kind of crazy sensations. And that's what I tell my patients. Your nerves, all that, you're getting on your nerves. Your nerves are letting you know we're suffering. And so that elevated sugar destroys the nerves in that way by drying them out. In addition to that, all the tiny little blood vessels that are around can get dried out too. And that's our tiny little blood vessels in our feet. Stop when they get dried out, they stop working. They don't work as well.
Wow.
Yeah.
And so we call that diabetic neuropathy.
Yes.
Neuropathy. And so that can be a real problem. Now, if you get the sugar down, does it improve the process, or is it, once it's bad forever?
So there's different degrees of neuropathy. So once you get to a point, and this is in my experience, where your nerves have been screaming at you and you have the burning pain and all that, eventually your nerves say, I give up, and you don't feel anything anymore. And so that's called loss of protective sensation. So you don't feel anything. And when it gets to that point, I have not been able to see that reverse. But if you're in a place where your nerves are still talking to you, so to speak, yes, if you control your blood sugars, if you get them down, that pain sensation can be lessened and go away. And I've seen it. I've seen people be able to do that with changing their diet or getting their blood sugars under control. Absolutely.
Wow. And then so part of it is circulation, part of it is drying out, part of it is the nerves. It's a complex process.
Absolutely. Diabetes is a complex process. That's because the sugar gets in the blood. I say it's all about the blood. Anywhere the blood goes, sugar's going to affect it.
Okay.
Yeah.
We've been here with Dr. Janelle Green. Dr. Janelle Green is a podiatrist, and her company is called
Happy Feet Podiatry, here to rejuvenate your soul.
Here to rejuvenate your soul. And that's what we're talking about. We want to have Dr. Green on a regular basis to give us little tips about our feet, because you'll hear me say all the time that if you knew better, you could do better.
Absolutely.
All right.
Absolutely.
And Dr. Green, how can we get in touch with you?
You can get in touch with me. I'm located at the Watson Wellness Center, 5709 Market Street, right here in Oakland. You can call the office directly, or you can call my office cell at 415-233-8875.
And one thing we really didn't talk about a lot is that a podiatrist is also a surgeon.
That is correct.
And you actually are trained and certified in doing surgery on feet if it is necessary.
Correct. Soft tissue surgery, if you have a lump or bump and you're trying to fit it, it's painful and we need to take it out, or if you have a bunion or a hammer toe, absolutely. That's what we do.
All right.
Yeah.
We're here with Dr. Janelle Green with Happy Feet. I'm Dr. Jeffrey Watson. Remember always that your health is your wealth, and when you have your health, you have everything. We'll see you next time.
Thank you.
I'm Dr. Jeffrey Watson. Thanks for being with us on this episode of the Healthbeat Show, where we try to educate you about different aspects of healthcare, about eating right, exercising right, what you can do to help yourself, how to access the healthcare system, what kind of questions to ask, what you should do for any particular disease state. Because I always believe that your health is your wealth, and when you have your health, you have everything. I'm Dr. Jeffrey Watson. We'll see you next time.
You don't have to take my word, but I heard if you have your health, you have everything.